Thank you very much. Thanks to organizers for the opportunity to present. I too would like to acknowledge the traditional custodians of the land on which we meet and pay my respects to the elders past, present, and all Aboriginal and Torres Strait Islander people who are today with us. Just a disclaimer, I'm a social scientist. I am in a room full of clinical expertise. So while I'm going to be talking about some strategies to have better conversations, rest assured that I'm not teaching here. I'm just sharing a few social science tips that you could add to your toolbox that works for you and is based on your experience and expertise. Do we move with this? Okay. There you go. So I have framed my presentation to address learning objectives for RACGP, but I hope that the content is useful to all healthcare professionals who attend this meeting, just as a reminder of the factors influencing vaccine uptake. And I will be focusing on the acceptance factors, which Jess pushed aside, which is very good to push aside because they do dominate our narratives about the factors that influence uptake. But this is what I'm going to be focusing on today. The role of health service providers in influencing vaccine uptake and the communication strategies and resources that could be helpful to do it. So let's start with those. Again, this is just a reminder because we already have heard about a variety of factors that influence uptake. So on the left, we have factors affecting motivation. You're very familiar with those. For example, are people aware that they are eligible for vaccines? Do they accept vaccines as safe and effective? And have they been encouraged by healthcare providers or families and friends to vaccinate? And on the right-hand side, we've got those practical barriers that Jess talked about and also Christy Crooks talked about in reference to First Nations vaccinations. I will talk very briefly about vaccine hesitancy. I agree with Jess that we talk too much about the vaccine hesitancy. However, because we talk so much about it, let's just be clear what it is. So it's a state of being conflicted about or opposed to getting vaccinated, which may mean that people delay, are selective about, or refuse vaccination, even when it's available to them. It's really important that we understand that vaccine hesitancy only applies to those motivational factors listed on the left-hand side. So it does not encompass the practical barriers that are so important to address for the optimal vaccine uptake. But my talk today will focus on the left-hand factors. So being hesitant about vaccination does not mean that the person will decline vaccination. In fact, many people who are initially hesitant will still vaccinate. Being hesitant about vaccination may have underlying causes. This slide from Julie Leask really shows some of those. For example, the patient may have had bad experience with vaccines, or there might be some issues with trust towards medical community and towards the government, or some personal values. So as a healthcare provider, it's really important to, first of all, acknowledge that there might be those underlying issues, because it does help with having empathy toward the patient and to with tailoring your messages to the patient's journey. And this is just a reminder. And again, you are experts in your experience, and the healthcare professionals have really important role in building people's confidence in vaccines. Their recommendation can help people accept the vaccine, even if they're initially hesitant. Equally, if healthcare professionals don't address their own uncertainties or doubts about vaccines, this may negatively impact on whether they get a vaccine themselves and how well they address vaccine hesitancy among their patients. So those are some take-home messages from the first part. While I'm focusing today on vaccine hesitancy, it is important to remember it's one part of larger picture of factors influeing vaccine uptake. Important to remember that hesitant individuals may still accept vaccination, and that leads to the important role of healthcare providers in actually building vaccine confidence. So let's go to part 2, where we're going to be talking about, as a healthcare professionals, what can you do to build patients' confidence in vaccination? Well, first of all, I think it's very important to answer your own questions about vaccination, to build your own certainty, and to clearly understand the benefits of different vaccinations so that you can feel confident in conveying that message to patients. And sometimes it's confusing where to find relevant information. So here I listed a few links from NCERS because I work for NCERS, but there are also reliable information on governmental websites. For example, on NCERS, we've got fact sheets and FAQs, which are a repository of answers to common vaccination questions and concerns. And this information is continuously updated and has gone through rigorous checks. We also organize vaccine webinars designed specifically for providers. And I also encourage you to register for our NCERS weekly jab newsletter. So what's next? Once you've got reliable information to answer patients' questions and your own questions, it's good to use supportive, evidence-based vaccination communication techniques. And today I'm going to be talking about SKY. And thank you so much, Sarah, for stealing my thunder. I loved that. I think it's great that we, encourage people to access SKY, get familiar with SKY. SKY stands for Sharing Knowledge About Immunization, and it supports effective vaccine communication and decision-making by supporting both the providers and the communities. So for providers, it has a website, training, and resources to improve communication skills and confidence in having conversations. But also we have an e-learning module, which is free, available for free, is eligible for CPD points, and it takes less than 90 minutes to complete. We also have reliable, trustworthy, user-friendly information for patients that providers can either share during the consult or, guide the patient to go to the website and check for themselves. And just to let you know, this has been a very collaborative enterprise. SKY has been designed by people from NCERS, the University of Sydney, Professor Julie Lisk, and MCRI. For example, Jess was amongst the team who created original SKY. And it is a program funded by the Commonwealth Department of Health. So what are some SKY communication guidelines? Today, I'm not going to go into detail. So details are available on our website and on e-learning. But some of the underlying principles include, first of all, the idea to adapt communication goals to the patients in front of you. So depending on whether the patient is accepting or even demanding vaccination, has questions and concerns, or currently declining vaccination. So with hesitant patient, the goal is to listen and to address patients' specific concerns and provide evidence-based information. And the goal for conversation with patients who are currently declining is quite different, which is not to try to persuade, but maintain trust via respectful interactions. And that leads me to another underlying feature of SKY, how to have those respectful interactions. SKY is built on good risk communication, which means, first of all, to acknowledge uncertainty, because being overconfident, over-reassuring, or minimizing risks may reduce trust. It's also important to be open and transparent, because withholding information, again, can erode trust. Communicate clearly, which means demystify vaccines by explaining how the vaccines work, how they have been tested, how they have been monitored for safety. At the same time, try to do it not using jargon. And finally, communicate with empathy, which really relates to what I mentioned before. It's about acknowledging people's underlying reasons for having questions and concerns about vaccination. So this is a summary slide for my part 2. For healthcare providers who want to have supportive vaccination conversations with patients, it's good to have credible information at hand, use evidence-based communication techniques, and then adapt communication style to the patient in front of you. Which leads me to the third last part of my presentation. I'd like to share with you just an overview of the resources that are available on Sky. So now the combined Sky and MamBabVax website and resources are under Sky banner, where you have access to resources to support you in your conversations about vaccinations, about pregnancy, newborn, childhood, as well as how to address misinformation amongst adults and how to have conversations about vaccinations with Aboriginal and Torres Strait Islander people. All of those resources are evidence-based, informed by research, and co-designed with health providers, consumers, and some with First Nations people. They are not meant to be prescriptive. You can easily adapt them. And the goal for Sky is to become a national hub of immunization, communication, resources, and training across the lifespan and across the wider population. And that's why, again, building on what we heard before, we are expanding Sky, and currently we are working on Sky for adolescents, including HPV vaccines. Yeah. So how are we going on time? Do I have another couple of minutes or 3 more? Great. I'm just going to very quickly show you some of our newest resources that we developed in the last year and a half. Starting with a couple of new resources designed to support COVID-19 vaccinations in pregnancy. And so in the next few slides, you will just see snippets of those resources, just so that you have a taste of how they look. So the first one in this series answers common questions about COVID-19 vaccination during pregnancy. So this slide shows 2 of 8 questions with excerpts of answers, but some other questions answered in this resource include: what are the risks of COVID for pregnant people? Is the vaccine safe for me and my baby? Including, how does COVID vaccine affect breast milk? We also have a guide to help providers have supportive conversations with people who have questions and concerns about COVID-19 vaccination. So this slide shows a snippet from 6-step long guide with a close-up on step 4, find out all patients' questions, and 5, share knowledge. And each step is briefly described. Next, just highlighting that we produced also several resources to support vaccination conversations with adults. Let's talk about the last one on this slide, which is one of our most popular resources. So this conversation guide addressing vaccine misinformation helps to understand what to do when an adult patient shares their strong belief in vaccine misinformation. And again, a close-up on 2 steps out of 5. Step 1, state the facts. Step 2, warn about incorrect information. And as you can see, there is a brief description of what the step entails, but also we provide some suggested phrase that you could adapt for that step. And the third last group of resources I wanted to talk about today is resources that have been designed to facilitate vaccination conversations with Aboriginal and Torres Strait Islander people. They do focus on flu vaccine, but they could be adapted to other vaccines as well. The real strength behind those resources is that they are based on our research with Aboriginal and Torres Strait Islander people, and were co-designed with Aboriginal people as well. So they really reflect communities' helpful advice on how to address families' key questions and concerns and suggest some culturally appropriate phrases. So let's have a look at two of them. Talking about vaccination with Aboriginal and Torres Strait Islander Families Guide is intended mainly for mainstream providers and health services more broadly, to help create a culturally safe space to build rapport with families, to then enable better vaccination conversations. The guide contains a list of topics with short explanations and examples of expressions that providers can use. For example, some of them include why and how to ask patients about Aboriginal status, why it's important to take a family approach and offer vaccination opportunistically. And the last resource I wanted to share with you today is an example of an actual flu vaccine yarn or conversation between a provider or community vaccination champion and an Aboriginal person who is unsure about having a flu jab. It uses Sky principles that have been adapted with cultural lens, and again, helps to know what to say and how to say it. And I will leave you with this summary slide, which concludes my presentation. Thanks so much.
Thank you so much. It's the work from people like you and the organisation that you represent that helps me, people at the front line, to actually have these conversations and make it happen. So don't sell yourself short just because you may not be a clinician. All of us in this room all play a part, and it doesn't happen without any, can't do without any one less of us. If there are any questions, whether it be online, please submit your questions. Andrew will send them through to me for Dr. Kasia. If there are any members that would like to ask a question, please come up to the microphone. In the meantime, I would like to ask a question. I saw those lovely resources. I like to use the ones with the multilingual fact sheets, and I love it because for things like simplified Chinese, I'm not very fluent. It takes me a long time to read. I love having the English on the side so I can track the conversation while I direct my patients alongside. Apart from Arabic, simplified Chinese, Vietnamese, English, are there plans for other languages?
We'd love to, and this is definitely a direction we see that needs expansion. Currently, there's no work underway in that direction.
So if anybody has spare funding, I'm hearing, please send it that way. Yeah. Any other questions from the audience before? Oh, yes, please come to the microphone. Just so our online members can hear.
Sorry. So Ira Moran again, just a clinical nurse with the school immunisation. So just regarding the immunisations that we do, which is your meningococcal B now and ACWY in Queensland. So we've added in the Bexero. We get a lot of questions around why we're needing that one as well as the other. Are you guys planning to do any information? I know you have it for the childhood immunisations, but once again, there is really limited information for adolescents. I know you're doing some around the HPV, but is there any plan for the meningococcal?
Yes, absolutely.
Okay,
I guess,
Thank you.
I focused on HPV, but yeah, there's going to be expansion to all adolescents vaccines.
Thank you.
We might add Beyfortus RSV pediatric to the wish list as well. I'm sure it's all limited by funding and people and hands and resources.